Hello, everyone, and thank you for joining us today. On behalf of Authenticx, we are so excited to have you here with us. We wanted to kick off our time together with a reflection of the single most important source of information that we have about our business. And that source is the voice of our customers. And for some, it's a voice that might sound like this one.
I thought my doctor's office sent the enrollment form in, but you're telling me they only sent in one of the 4 pages and that they sent it for the wrong medication? I mean, can someone call my doctor's office tomorrow and explain this? It's 2 weeks now I've been trying to get this prescription filled. This is insane. I've talked to you a dozen times. I've talked to my doctor's office a dozen times. And obviously someone from your company needs to call someone from their company so you can get my medicine. It's like between the two of you, you're holding this hostage. This isn't for an aspirin or something that you can miss. It's life-saving medicine.
There are some things that we can't unhear in life, and this clip is one of those for me. When I first heard this, I imagined someone that I loved in the situation that this patient is in. I could feel my heart breaking because of the emotional toll and the ability to put myself in the shoes of this patient. You know, all of us on this webinar get out of bed every day believing that we can make a difference. Yet somehow, some way, we have customers that feel this way. They feel trapped. They feel held hostage. And it's not just in the healthcare industry. It's across every industry. We have an opportunity to learn from these customers, just like we can learn from our loyal fans. We can learn from them when we open our hearts, our minds, our ears, and we truly listen to them. When we listen and we hear the voice of our customers, they show us the way. They help each of us accomplish why we get out of bed, to make a difference in their lives, in our lives, and in our business as well. My name is Leslie Pagel, and I have spent my entire career, over 25 years, helping organizations understand the experiences that their customers are having with them. And through this understanding, create experiences that customers appreciate, value, recognize, and reward. It drives business outcomes. It drives outcomes for customers as well. 5 years ago, no one would be in a webinar like this talking to you about how a machine can listen to the everyday conversations that you're having with your customers, and how this listening can help us achieve our goals for our customers and for our business. Well, today, in the next 30 minutes, we're going to do just that. We're going to talk about how what was not possible 5 years ago is possible now. I've got just a few housekeeping items before we dig into the meat of it. First is we are recording this session, and we'll be providing a copy of that recording after the session today. Second, we will save time for questions at the end of this. It's my favorite part of the webinar, so we hope that you will use the Q&A feature at the bottom of your screen to submit questions throughout the presentation, and we'll save time at the end to answer those. It's also important to share an introduction of Authenticx. Authenticx is a conversational AI company. Now, if you were to go and Google conversational AI, chances are the top hits would be companies that are using AI to replace or assist humans in a conversation. That is not at all what we do, and it's not what we're going to talk about here today. Today, we are going to talk about using conversational AI to truly hear, the voice of your customer, to unlock a gold mine of insights that your company can use across the enterprise to drive progress and to deliver business outcomes to the organization. Last piece of housekeeping. I use the word customer all the time. And when I talk about customers, think of it with capital C. I'm talking about patients, caregivers, doctors, pharmaceutical reps, payers. I'm talking about distributors, partners. For purposes of our time here today, when we use the word customer, think about all of the stakeholders that you serve in your business, including your employees as well. Today, we're going to focus on three things. We're going to start by making the case for conversational AI. And in this, we're going to explore how conversational AI delivers the ability to shift your contact center from being seen as a cost center to being seen as the single most important source of business intelligence for the enterprise. We are going to bring that to life by sharing with you 3 client case studies from across the healthcare verticals. And we'll wrap up with just a few steps that each of us can take to extend this conversation on conversational AI and to realize the benefits that conversational AI delivers to our companies. Companies across industries have been turning towards the customer experience as the battleground for market share. And one of the fundamental responsibilities to be successful in competing on the experience is to listen to our customers. Historically, companies have relied on surveys to fulfill this responsibility. The problem is our customers don't like our surveys. They don't like our Net Promoter Score programs. They don't like our CSAT surveys. They don't care about our surveys. Our customers just want to be heard. They want us to understand them, and our conventional methods of listening to our customers are not working. And let's face it, our customers aren't the only ones who don't like our surveys. Our leaders don't like them either. According to a 2021 McKinsey study, 93% of customer experience professionals use a survey-based metric as their primary means of measuring the experience. 93%, virtually everyone included in the study. When asked about their leaders, only 15% of the leaders said that they were fully satisfied with this metric. I suspect this rings true for you as well. Today, we're going to explore a data source that customers and leaders do appreciate. It's a source that already exists in your business. That source are the conversations that your customers are having every day with you when they reach out and touch your business. At Authenticx, we've been studying conversations for years, and we have learned a ton. We've learned about the purpose of a conversation, the nature in which conversations unfold, and the value that conversations deliver. When you think about it, at its core, a conversation is when 2 or more people come together and exchange information. Conversation is how we learn, it's how we connect, it's how we come to a common understanding, it's how we resolve conflict and solve problems. There are an endless number of benefits that conversations deliver to us. Here's one example. Dr. John and Julie Gottman are psychologists, and they've studied over 40,000 couples. And do you know in their research what they have found to be the single most important element in a lasting marriage? It's when couples turn towards each other, when they turn towards each other and engage each other in conversation. Conversations aren't just saving marriages, they're also benefiting in a corporate setting as well. An example of this is with Sanofi. Sanofi is a large pharma manufacturer. Earlier this year, they turned towards conversation for purposes of building trust within the healthcare industry. They launched a campaign called A Million Conversations. And this campaign is a global initiative that's focused on rebuilding trust in the healthcare industry with the underrepresented. And how are they doing that? Well, they're deploying resources to empower individuals from marginalized communities to engage with those in the healthcare industry. It's no wonder conversational AI is the fastest growing use of AI that we see. Conversations bring context and clarity to situations. They bring root cause understanding. Our customers have a lot to share, and they share it with us. They tell us where they've been, why they're contacting us, where they're going, how they're feeling. They paint this picture of the authentic journey, not the journey maps that are hanging on our walls in our corporate settings. They share with us the lived journey that they are going through, and they share this with us through the conversations that they have. And the beautiful thing is they have conversations everywhere. Conversations are ubiquitous. They are interacting with us online, through chatbots, through SMS, through IVR, through email, through video, like we're doing today. Conversations that our customers are having when they touch us are happening across the business. Because our customers have a lot to say, and they're sharing it with us in a lot of places, it makes conversations the single most valued renewable source of business intelligence within any business. By definition, renewable is something that's not depleted when it's used. The trash that we throw out, that's not renewable. Its use has been depleted. The materials that we recycle and we reuse are renewable. And it's time that we stop throwing out the voice of our customer and start harnessing it and reusing it to guide our business. One of the fascinating aspects of conversations that I found for myself is that when you study conversations, you have an opportunity to see different perspectives about your business. For example, when we listen to the customer side of a conversation, they tell us where they've been, where they're going, how they're feeling. They give us this insight into our business that's from their lens. The other side of the conversation is us. It's our employees. It's our frontline staff. It's the agents who are interacting with them. And when we listen closely to that side of the conversation, we see the experience that we're creating for our customers. We see where our team is struggling to support our customers as well. And then there's this third interesting dynamic that happens when you study the interplay of conversations, the back and forth exchange between customer and employee. It brings to life a different perspective for us to learn from. We have chosen these 3 case studies to highlight the different perspectives that can be gleaned in conversational analysis. The first case is focused on listening very closely to the customer side of the conversation. When it comes to a product launch in any industry, there is a lot on the line. There's years of research and development in healthcare, years of approvals, there's marketing, there's planning, there's building. It's no wonder that this pharmaceutical manufacturer wanted to keep its finger on the pulse of its customer experience at the launch of its product. Now, while we heard both sides of the conversation, we really focused in on the customer side of it because they wanted to understand, when are customers calling in their journey for this new product, and where are they getting tripped up in their journey? At Authenticx, we have a proprietary machine learning model called the Eddy effect. And we leverage the Eddy effect in this analysis for this pharmaceutical manufacturer. Now, an eddy is symbolic of water flowing down a river, which is very similar to our customer's journey that they experience. Water flows the fastest down the middle of the river because it's less likely to be obstructed by boulders and debris. But not all water flows down the middle. Some gets pushed out to the side, just like our customers get pushed out to the side in their journey. And when water encounters a debris or boulder, it causes the water to flow counter to the current, which keeps the water from flowing downstream. This happens in our customer's journey as well. And this pharmaceutical manufacturer really wanted to understand how it can drive its product acquisition for the new product on market by understanding where customers are getting tripped up in their journey. We use conversational AI to identify where their customers were in their journey. The graph here that you're seeing is showing the data in the journey sequence from beginning to end. The yellow bars in this data reflect where the customer is at in their journey. And the blue bars represent the proportion of those customers who are stuck in that journey stage. What stood out to this manufacturer was the diagnostic stage. It wasn't that there were a lot of customers calling in with questions about the diagnostics. It was that those who did call, over a third, were getting stuck in the diagnostic phase. And so we dug into that to understand, what is it about the diagnostics that are causing customers to get stuck in their acquisition of the product. And we learned that the main reason why customers were getting stuck in this phase is they didn't understand how their coverage would be applied to the testing that's required before they're able to get onto the treatment plan. This company immediately reacted, helping their customers, helping the doctors that serve those customers support their patients and caregivers, particularly in the diagnostic phase, so that they understood how to navigate their coverage. In summary, when we listen to the customer side of conversations, they show us the way. They tell us what they need, where they're getting stuck, why they need it. Conversational AI, it creates a capacity for us to do this listening at scale, where the human capacity to do this does not exist. Now, the second case focuses on the agent or the employee side of a conversation. This is a large hospital system who wanted to make sure that the patients and caregivers who were interacting with them when they called in had the best possible experience. And so we used conversational AI to assess the agent and the experience that they were delivering to that customer on the call. We assess the agent on 8 different quality skills. These are things such as, did the agent demonstrate perspective in the call? Did they take accountability for the customer issue? Were they proactively listening on the call, or did the customer have to repeat themselves? Did they help manage the customer's expectations? When this hospital system first started working with Authenticx and conversational AI, their quality scores were just barely above the minimum expectation of 90%. Now, within 2 quarters, they got up to the desired goal threshold of 95% quality. And they didn't stop there, they kept going. They achieved this progress in the experience that they deliver to their customers by listening to the agents, by improving some of the processes and systems that agents had to use, by training and retraining agents, and using conversational AI as a coaching tool and reinforcing positive feedback. This second case shows us that when we listen to our associates, they show us the type of experience that our customers are having. And through this lens, we learn the areas where we can invest in our team to create a win for them and a win for our customers. This third case highlights what we can learn by understanding the interplay of conversations, the exchange back and forth. This case is from a large health insurance company who wanted to proactively support its Medicare members who were entering into the coverage gap. Now, for those who might not be familiar with the coverage gap is a federally mandated rule that is a part of the Medicare Part D plans. Medicare Part D is the prescription drug benefit. And after a Medicare member hits this mandated limit, they're responsible for a percentage of the drug costs that they historically haven't been responsible for. For some members who are coming into the coverage gap, this percentage can be extraordinary. And as a result, it can create extreme emotion and shock once members find themselves in the coverage gap. Through conversational AI, this insurer had the opportunity of listening to the back and forth between the agent and the member. And what they found is that some of their agents were just simply stating, well, you're in the coverage gap. And when this was shared, the reaction from the member was a strong emotional reaction that accompanied a sense of confusion for the members. They didn't understand what that meant. We heard other agents look to kind of disassociate the health insurance company from the federal mandate by saying, when it comes to Part D coverage, the federal government creates the rules. The rules are not about what your plan is or what company you're with. We heard the reaction from members when they had this extra clarity from the agent. The reaction from members shifted that emotional reaction away from the payer, blaming the payer. It helped the members realize that the payer in this case isn't making the rules. We heard a third case where agents would take it even a step further, and they would help members understand the context of all of the costs. They would explain how much the medication costs, how much is still being covered, and then how much they owed. This approach helped members really remove the emotion from confusion and shock to feeling informed and confident about understanding their plan and their coverage. When we use conversational AI, it allows us to hear the dynamics at play with each party in the conversation. This helps us learn more about human behavior and ultimately help humans understand humans. Now, some of you may be wondering how conversational AI works. The journey of a conversation works best when we approach it with a both and mindset, appreciating the breadth that technology and AI gives to us with the depth of human listening and understanding. So most of your customers are already interacting with you, and chances are that interaction is being recorded in some way, shape, and form. A call recording, a chat script, transcript, a video file, an email. These conversations have historically sat dormant, but now AI is being used to activate them. It starts with leveraging AI to transcribe if it's a voice call, it transcribes the voice into text. From there, we use generative AI, which is a form of AI that creates new content from original content. We use generative AI to create what we call a conversation summary. In this example, it's an 11-minute conversation that would generate probably 1,400 words. We speak 125 to 100 words, 150 words a minute. Generative AI takes that 11 minutes and summarizes it into a few sentences, such as the example on the screen here. Generative AI with the call summarization is delivering a ton of value into business. One, it replaces this task from agents who are having to summarize the call in addition to all their other responsibilities. And two, it's creating a consistent summary of the conversation across all agents. After the transcription and call summarization, the journey of a conversation flows into machine learning. Machine learning is an artificial intelligence approach that gives machines the ability to learn. Machines learn through data labels that we tell it about our data. At Authenticx, we leverage humans from the world of healthcare who understand the nuance of healthcare to create data labels for our machine learning models. We have a variety of machine learning models. We talked about the eddy effect earlier, sentiment, hearing if HIPAA validations are identified on an interaction, detecting adverse events in calls. What machine learning gives us is the power to look at 100% of our conversations and analyze them. Our surveys are only returning 5–10% if we're lucky. Our machine learning on conversation allows us to look at the entire population. This is an example of the eddy dashboard, and through the eddy dashboard, we can see the impact that eddies are having on a business. We can see the impact in terms of how much additional time is spent on an eddy call. We can see the impact in terms of the cost that is being exerted to handle an eddy call. We can also look at eddies and see where eddies are more prevalent in different call topics versus others, and how eddies are changing over time. All of the steps that we've talked about so far are powered by AI, but some companies want to go a step further with human-level evaluations. This illustration shows that the AI-driven elements are reflected in the dark blue. The light blue represents elements where human added context. For example, on the top left, we see a coaching comment that is provided to the agent for this call. We also, on the right-hand side, see additional perspective about the eddy. What is driving it? And in this example, it was a prescription fill. Humans, when they listen to calls, they also have an opportunity to clip relevant pieces of the call. And these clips are then used to help bring that data to life. We bring the data to life through what we call an audio montage. One benefit of audio montages is that they help your audience, your internal audience, understand the data in a new way. It brings an emotion to the data that you're sharing. We've got a short 1-minute montage to share with you today. This is a recreated montage from a pharmaceutical manufacturer who wanted their employees to understand the range of emotions that their patients and caregivers express with them. I'm going to play the montage. You'll see 3 little clips from the montage. And as we go, I'll share with you on the screen the written text of what we heard in the call. Let's take a listen.
Yeah, it's very frustrating to have a drug that can help, but we can't get it. You can't help me. I can't believe I can't get any help. I mean, I know you can only give me so much information. It's not your fault, but it's just so, here's something that can help my dying husband, and I can't get my hands on it, and you guys can't get it to me. It's very frustrating.
Yeah, I called a couple of days ago and wasn't able to get through. And then as a follow-up, I got a thing requesting a consent form. So I was looking for something that said consent or looking for somewhere for me to put my name on it, and I didn't see it on the paperwork that was sent to me.
Oh, I was just going to say what upsets me terribly, deep breath, is that the thought of him, of me not living long enough to take care of him. I'm desperate to get him into the trial, just to try. If I can't get him in this, where do I go next? Where is there possible help for us? You know, when you get desperate, you do desperate things.
Through the journey of our customer conversations, we turn those conversations into quantitative data that speaks to our headspace and qualitative stories that speak to our heart space. And when we can connect our leaders, our colleagues, to both the head and the heart of our customer experience, it drives customer-focused action. Companies use conversations in a variety of initiatives. Earlier, we looked at one example of that with the product launch. The journey of a conversation allows healthcare companies to benefit from both the breadth that AI delivers with the depth of human listening. The result creates insights that drive action and outcomes for the business. We've got 3 ways that you can get started in your conversational AI journey. The first one is I encourage you to go and just listen to 10 calls. Pick 10 calls at random, and while you're listening, think about what you're hearing from the customer. Think about the experience that your front line is creating for them. Think about the dynamic that's happening between the two. And while you're doing that, imagine that at scale. Imagine the ability to quantify anecdotal information that we hear in business every day. Imagine being able to discover new insights about your customers. Last recommendation is to be really curious. Get curious about the type of data that you're creating and storing when your customers touch your business. Get curious about how your company's leveraging that data, not just to facilitate the conversation, but leveraging it for purposes of insights for the business. Get really curious about AI. How are AI models being built? What is the training data that's being used, and how is that training data created? We don't have to throw away the voice of our customer anymore. Conversations are full of contextual insights, and it's renewable source of understanding. The technology exists today to harness the breadth and depth of this data source, and companies who are leveraging it are using it to drive business outcomes and outcomes for their customers. If you want to learn more, there are a variety of ways that we can continue this conversation. This QR code, I'd recommend just taking a picture of it here. It will take you to an AI checklist, which is a wonderful resource for learning more about AI and conversational AI. The Authenticx website is also a wealth of information, including we've got a monthly newsletter called The Pulse, where we're keeping the industry updated on happenings in the industry as well as at Authenticx. Feel free to reach out to me directly with any questions that you have. And with that, I will turn to the Q&A, which is my favorite part, and we'll answer some of the questions that have come through. Let me take a look. Here's one. Where do you see conversational AI going? Where is conversational AI headed? You know, when I look out into the future, as someone who's spent my career in customer experience, I see customer experience metrics dramatically changing. Customer experience is no longer going to be measured from survey data. It's going to be measured from the moments when our customers touch our business. So gone are the days of surveys as our CX metric. I also see an increased emphasis on AI that is serving good and that's validated for the business. And an outcome of this is going to be AI that is built from more industry-specific insights, information, and data labels. I can also see conversational data being more omni-channel. So I guess omni-channel listening, where we're not just taking in one source of conversations, but we're really looking at all of the areas that our customers are having conversations with us, and we're listening across all those channels and starting to connect those conversations to each other. Those are just a few of the kind of top things that come to mind for that. Here's a question around, you talked about conversational AI in terms of breadth and then the depth of human listening. How much should humans listen versus the AI? This is a little bit of a it depends type question. There does need to be some human listening. That's how the machine learns over time. So there's just naturally some human listening for that. I'd say it depends, though, in terms of what business questions you're trying to answer. If you're trying to understand, is this thing that I'm hearing from the business just anecdotal, or what type of data can I bring to the business to support what we're anecdotally hearing? For that, very little human listening is needed. You can go in, you can tell the machine to find those types of conversations. It will tell you the prevalence. It'll tell you how that's changing over time. It's the questions that are a little bit more depth, like the one that we saw earlier with the product launch, where they really wanted to understand in this phase, this diagnostic phase, how are our patients and caregivers getting stuck? And that's the type of business questions where AI can get you to the area of interest, but you'll want to do some human listening to really understand, okay, when there's an eddy in diagnostics, what's behind it, what's causing it? And the human listening adds the context there. I am not seeing any other questions come through the channel. I'll pause just briefly to see if there's any final questions coming through. And nope, there are not. So with 4 minutes left, I would like to thank all of you for taking the time out of your day and spending it with us at Authenticx. We hope that you are learning about a new source of insight that your business can leverage. And we hope that we've expanded your understanding of its application to create outcomes for your business and for your customers. Thank you all very much for your time today, and we hope you have a wonderful rest of your day. Thank you.